name is Jeremiah Okuto. I work for County Government of Kisumu. I coordinate mental health and psychosocial support services. The presentation I want to make is about the voices of young people from Kisumu, Mombasa, Nairobi. This was a cross-sectional survey that was done with the support of Liverpool School of Health in partnership with our stakeholders in Kisumu, Mombasa, and in Nairobi, including Ministry of Health and also other county government officials. So I want to echo the voices of young people. Some of the information that you may be getting will be common knowledge, but one thing that is important to research is that it gives us something that is new that we can work on as we work with young people. LPCT Health, together with the University of Maryland, School of Social Work, and School of Medicine, Broadcasting Therapy, who is research. The lead team is Professor Bill from the University of Maryland School of Medicine. Then we also have the University of Maryland School of Social Work, Professor Wagner. So this was an initiative of READ program, which is a project of LBC Health, which is rating and educating adolescents and young adults for care curriculum in health and mental health. READ is actually using one-to-one different platform to collect qualitative data using Reach app. Then it is also using interviews to collect qualitative data from individuals, families, and community at large about health systems and adolescent and mental health. So part of what we are about to present is actually based on the experiences of each project in working with adolescents and young persons, and they identify some gaps. And based on critical review, some gaps were identified which require the voices of young people. Basically, that might not be very important, but it's something that we all know. It's something talking about what is existing in literature, what has been known about adolescent and young person, especially when it comes to their mental health issues. Now, some of the key questions that we can be asking ourselves is that if they have depression, how many of them know they have depression? And how many of them present in our health facilities that have depression and need care? Most of the times they are referred by experts or they are referred by others. If you talk about pregnancy, didn't pregnancies, how many of adolescents attend our health facilities because they have psychological issues related to pregnancies? Most of them find they will be coming to our health facilities because they need ANC care, and the ANC care will take care of their health. In most cases, their voices on mental health and psychological issues may be a secondary intervention. And so we are saying adolescents may have a lot of issues. Some of them may have low self-esteem, and they present themselves to our health facilities that they have low self-esteem, and they require us to pay their low self-esteem. Most of the times they are referred by others because those others are uncomfortable and we want require them to present for care that at least their issues are addressed. So this is something that informed the background of the study. The study wanted to get the mental health challenges faced by adolescents, they know, and young people in Kenya. And so a one-day meeting was held with adolescents and young persons, plus stakeholders. This was a virtual meeting. It was actually a hybrid meeting. In some countries, it was physical, but there are also people who joined online. The team wanted to find out the support system, how can we support adolescents based on what they say themselves. And so, because it's a purely qualitative study that involved young persons aged 21 years and above, these young persons were actually youth leaders. Most of them were actually health champions. They were leading adolescents, and so this is a group of young people who are empowered because of their exposure with our healthcare systems. And so they were able to at least identify some of the issues around health that are affecting adolescents, and also talk about other issues that are affecting other adolescents who are not in their category. So they were basically youth leaders, and some of them were health champions. The ones who are health champions were engaged in other health programs, like HIV and AIDS. And so the methodology that we used was basically quantitative review, one day hybrid stakeholder meeting. The participants were adolescent young people, 18 years and above. 25 stakeholders took place took part in the study. The study was done in 3 counties: Kisumu, Kisumu, Nairobi, and Mombasa. The data collection involved this desktop review of existing report, our existing literature. There were also focused panel discussions by the researchers. After the interview, the researchers had a lot of consultative meetings, and they also reviewed the qualitative data, and they reviewed the issues which were emerging from what adolescents were saying. So basically, this was a quantitative study that was trying to categorize views and also look at meanings of what they were saying. And so the voices that I'm going to present are given poverty from the debate we're saying, and the most important thing that we interested in is, if this is the way we're saying, how then do we get into their lives? And so the demographics of the study participants, we had 14 youths who are aged 21 to 24. Then we also had 2 youths who were aged 25 to 29. That made a total of 16 youths. Then we had 4 stakeholders also who are also aged 25 to 29. Then above 35 years of age, we had participants who were around 15, and all of these were stakeholders. So in total, we had 41 people who participated in the study, 25 stakeholders, and 16 youths. So the voices that I'm going to give is actually based on the voices of the 16 youths, and the recommendations are based on the analysis of the 25 stakeholders who are present. So these are the findings based on the categorization of emerging themes. Adolescents are talking about our public health facilities. And we are saying that public health facilities do not have trained mental health personnel. They focus on other areas, but they are only trained in a certain line, so they are impacted. This is tech poverty, the way we said it, and we are talking about negative mental health narratives in general care provider attitude towards mental health issues. That pose hurdles for them when they seek medical care. Of course, the regions will be different. What is important for us is, like, if this is what they're saying about our health facilities, how does it reflect on our own health facilities? We can find out more and see our best. There were also issues of age difference between the healthcare provider and adolescents. They were saying the age difference between the healthcare provider and adolescents contributed to negative attitudes, leading to fear and bad information conditions. This is one of them. One of them say, imagine going somewhere where you will be judged wrongly, or somewhere where you will be overjudged. For instance, if a young person walks in a facility where there is an older woman, maybe their moms or dads age, they might find it difficult to access these services because of the age gap as a social norm. So that is what we are saying. That is their perception, that the service providers might not be of their area, so they want to get people of their age. This might not be new knowledge. It might be something that we have known about in the past, but how does it translate to the current practice? That is important. Then another thing was, we were talking about non-privatization of mental health in healthcare settings. That leaves most mental health issues are not always young persons are diagnosed and unaddressed. Remember, these are groups of young people who are empowered. They know about some they have some literacy about mental health because of their interaction with the healthcare systems. I mentioned that some of them are also adolescent health abuse, but they're saying that if a young person comes to the facility, they don't take it as a major problem because you just treated for your malaria or you treated for your SRH or SLT. But the mental health is integrated at that point. Probably the reason why I'm coming there is not just for contraceptives, but I may be having some other problems, those challenges as a young person. So they were saying that our focus is in health system is based on providing the care and this kind of care sensitivity. And so when they go, most of the times they might not be able to share their psychological issues. For example, adolescents who are we have EPS centers, gender-based recovery centers in most of our settings, and when they come there, most of the time it's an emergency because of physical health, it's actually from physical abuse. But in most cases, they don't present themselves. The ones who get psychological abuse, they don't, even emotional abuse, they don't come there and say that my partner is abusing me. Can you get care? But most of the times, they are related to emergencies. So this is what they're saying, that when they come for other elements, it's important that at least some of their psychological issues are also investigated. Then there are also issues around stigma. Even public health facilities are there, but they are not well integrated. They are separate. The ones that have received personal mental health is separate, so it comes with stigma. So when a young person, my friends will be going there, they will ask whether I'm crazy. That is the view of that young person. What it means is that most of the health facilities, we have service provision points which are distributed for some area. For example, we have patient support. Most of the adolescents who come to health facilities come because of some issues which they feel are life-threatening. For example, HIV, they want to attend PSC for HIV care, and people associate those support centers with some particular issues. So they are labeled. When they come there, there's no space in a facility which is adolescent friendly, which is not for other medical elements. The adolescent and young person express more comfort in to have beer mental health. Involving young people as part of studies like they can be trained, maybe you have the educators. So what we are saying here is like, can it be an interactive session where even their peers, even this the rest of the people who participate in the study, the adolescents, or maybe the youths who are youth leaders or the champions, They're saying if they are trained, you will have good knowledge mental health, then they can go to at least have positive impact on their peers. There were key recommendations based on the analysis of the experts, the people who participated in the study. Because some of the voices they were talking about were also around financing for their adolescent or young person's mental health. The need for health insurance financing covers mental health issues which are not addressed. Some of them are being addressed as now. Those are the recommendations that were made. I want to say thank you. That is the end. But the most important thing, can we be able to look at the context based, the context of where we work? Are the issues similar? Some of them would have been main issues that have been carried over for years. But thank you.
Thank you very much, Jeremiah.